for the cardiovascular system under congenital defects. The next defect that's discussed here is the Tetralogy of Fallot or Fallot. Here's a diagram of the heart. A reminder, deoxygenated blood comes from the body into the right atrium, like the superior vena cava and inferior vena cava, all those, into the right atrium. From the right atrium, passes through here into the right ventricle, and from the right ventricle it is pumped into the lungs. From the lungs, it becomes oxygenated in the lungs, and then it is pumped from the lungs, or passes from the lungs, into the left atrium, where then it passes down here into the left ventricle, and then from the left ventricle, it's pushed through the aorta and into the rest of the body. So that's the way that the heart works. So in the case of a tetralogy of Fallot, what's going on here is that the person has four basic things that are going on. First of all, they have right ventricular stenosis here, coming out here, this like a pulmonary, whatever you call it, stenosis. So this here is narrow. This is pathologic. Narrow little opening there. Makes it more difficult for the blood to come through. There's also ventricular septal defect. A ventricular septal defect is when there's a hole between the ventricles so that blood can pass across and go this way. So what you get is some of the mixing of this blue blood, deoxygenated blood, in here with this blood. That's not good. The other thing that can happen in a tetralogy of Fallot is that sometimes the aorta, I guess, will override the ventricular septal defect. I'm not sure exactly what you meant by that in the video, but anyway, so those are some of the things that happen in the case of tetralogy of Fallot. So let's talk about what happens then when this occurs. So if the person has a stenosis here, then they're going to get a right to left shunt, meaning that the blood in the right ventricle is going to get shunted over to the left ventricle, which means you're going to get deoxygenated blood mixing with oxygenated blood. And this mixture of deoxygenated blood is then going to get pumped to the body. And so this is typically happens in babies. It's a congenital defect. And so the baby will run around, a little kid will run around and get use up a bunch of energy, and they'll have higher oxygen demands in their body because they're exercising. And the baby will start to turn blue, get a cyanotic baby. Its face will turn blue, lips blue, because it's not getting enough oxygen to its body because of this shunt that's occurring here and the ventricular septal defect. So blue baby syndrome, I think is what they sometimes call that. That's cyanotic baby. If you were to look at their heart on x-ray, you'd see that their heart has kind of, they call it a boot-shaped appearance, where essentially it's shaped a little bit more like this than normally a heart would be. Another thing that they'll see is the baby will run around and start turning blue, and the baby will squat down like this. And it's squatting down, actually it's a learned behavior that's really intelligent. What it's doing, squatting down, is actually, it's increasing the arterial vascular resistance. So essentially it's almost as if they're squeezing down on this a little bit. They're squatting down, they're increasing the resistance on their arteries, which is going to resist this shunting from occurring. So this will back up a little bit here because there's less ease of flowing out there. And so it'll actually push more of this blue blood into the lungs as opposed to into the body. And kind of decreases the shunt, allows more blood to go to the lungs so the baby can get oxygenated. And those are some of the main things that you'll see in the case of tetralogy of Fallot.